Jen Cates, thanks for being here. The Kaiser Family Foundation and UNAIDS recently came out with its donor funding report, done every year. Major result?
The major result, and this, let me just say, this report, which we've been doing every year, looks at donor governments. So that's what we're looking at. What are donor governments providing for the AIDS response? The main result, it's been essentially flat since 2008. So when the economic crisis hit, right after that, funding is not going up. It's about the same level as 2008.
But it's not gone down.
We had a blip down that went down last year, and that was due to a slowdown in disbursements by the U.S., which is significant because it's the largest donor. So when the U.S. changes, it can affect things. But it looks like it was a 1 year thing. So it hasn't gone down in general, but it isn't going up. And we know that the needs are still there. So it is a challenge.
At this morning's session at the AIDS conference, Secretary Clinton spoke about a realignment in funding to support, to a greater degree, combination prevention. What does that mean, and what drives that decision?
Sure. So the idea of combination prevention actually has been one that folks working on prevention have talked about for a while. If you think about combination antiretroviral therapy, the concept there is you can't attack this virus with one thing. You have to attack the virus with multiple drugs. Prevention is the same way. There's no one prevention intervention that's going to prevent somebody's risk of acquiring HIV for their entire lifespan. You have to give them multiple combination interventions, and the combination matters. You get the combination you might give to a woman who's married might be a different combination than you give to a young person who's sexually active and not with a partner. So the idea here is that if we know the various tools we have in the prevention toolkit, what's the right combination to scale up? And that's what she was talking about. We have great prevention tools now available. And what she was saying is we're going to combine those, scale them up, and get them where they need to be. And she was focusing on a few key interventions there. Condoms, so definitely condoms are in the mix. Counseling and testing, definitely in the mix. And then voluntary male circumcision, treatment as prevention, and PMTC. And so the idea is if you...
Prevention of mother-to-child transmission.
Right, and the idea is that if you take the right combination in the right settings, that's how we can turn the tide. So it's not one on its own.
And she said today the goal is to eradicate mother-to-child transmission by 2015.
Yeah, the goal is that no baby should be born with HIV, and that's the target. I think there's been tremendous strides in that direction. There's a long way to go still, but I think people are very hopeful. In the U.S., for example, when we first had the results from trials showing that antiretrovirals could dramatically reduce the risk from mother to child, it was scaled up. It was really rolled out in a big way, and we virtually did eliminate mother-to-child transmission. There are transmissions that still happen, but very, very few in the U.S., and I think that's the goal here.
So if this realignment in funding occurs, does it come at the expense of something else that previously had been funded and focused on?
I don't know what the U.S. government would say, but I think I think to some extent there are interventions and things that were being done that shouldn't be done anymore. They're not necessarily the things that we need to do. I think we've learned a lot in the last few years on new research that certain things need more emphasis. Maybe treatment as prevention, we didn't calculate that into our equation as much as that's really going to help us on the prevention side. The good news is that we've been scaling up treatment. So treatment has two effects here. It helps the individual living with HIV and has this public health benefit. But for example, have condoms been scaled to the way they need to be? Or has maybe there's been a focus, sometimes it's not just what the intervention is, but where it's being deployed. So is the right intervention getting to the right people in the right setting?
Okay, thank you so much.
Sure.
Jennifer Cates of the Kaiser Family Foundation.
Thank you.